In Benefits Alliance, we've talked a lot about mental health solutions over the last few years, Caroline. And we've all had a lot of clients where they've increased their practitioner benefits or they've wanted to extend an employee assistance program, but they're looking for more solutions for those real unique situations that don't affect everybody every day necessarily. And I feel like we found a fantastic new partner with EHN Network, an organization that maybe a lot of listeners have never heard of.
Yeah, so EHN Canada for sure. I mean, from the journey that I've had through our process at Benefits Alliance, I've learned way more in terms of the resources. And I think what we know today is that employers are needing and willing to spend more money to get the right solution because ultimately disability costs, right? And having a long-term disability is going to be thousands and thousands of dollars per month. Now, we've got a solution here that has been built that's going to help people through the mild to moderate to severe conditions, has a different offering and a different price point, but is ultimately going to help people be productive and healthier at work. So let's dive in and help share with everyone what this offering is and welcome in David and Rochelle from EHN. Thank you for joining us today from EHN Canada. We've got David and Rochelle. David, introduce yourself, a little bit of background, and then we'll move over to Rochelle.
Yeah, sure. So I am the Director of Business Development at EHN Canada. I've been with the company for about 6 years, never actually started in the business role. I had more of a clinical role before. I came from a background of working with children with disabilities, particularly fetal alcohol spectrum disorder. Kind of got interested in addiction because in working with the families of those with that disability, you learn more about addictions. Started my tenure with EHN back in 2018 and working with our admissions department, helping people get into treatment, and then eventually migrated to the business team about 3 years ago. So happy to be here with you.
And Rochelle, tell us a little about yourself.
Sure. Yeah. So I'm a senior executive director with EHN Canada. I have been with EHN Canada since almost the founding, just a little bit after. And I oversee all of our outpatient programming across Canada and soon to be in the US. I've worked in a bunch of different roles at EHN, but really found my place about 5, 6 years ago in the outpatient world and treating folks at home.
And
Uh,
for those that are listening that don't know who EHN
yeah.
is, why don't you tell us, Rochelle, a little bit about EHN and maybe the history of it and how you've expanded and where you're looking to move forward today?
For sure. Yeah. So EHN was founded just over 10 years ago. And really, the purpose of EHN Canada was to create a nationwide network of mental health treatment facilities all across the country. And so we started 10 years ago with just two treatment centers, one on the West Coast in Nanaimo called Edgewood, and one here in Toronto called Bellwood. Each of them had their own really, really rich history in Canada of treating folks. We started with those two, and over the last 10 years, we've grown to 13 inpatient facilities across the country. We just opened three this month, so it's been a busy time. And then also creating a fully virtual outpatient clinic that serves the entire country as well. So it's been a really big 10 years. And our purpose really is super simple. It's about making mental health treatment accessible, affordable, and excellent for all Canadians. That's what we're here for.
Wonderful. And Rob, if I may interject to say, like within Benefits Alliance, our advisors, well, you're an advisor, obviously. A lot of clients and our organization recognize that there's a lot of support out there for a preventative EAP, that mild to moderate continuum. You get EAP, kind of that consultation on the phone for a maybe short-term issue, but what's out there for that moderate to severe end of the spectrum when people have some real serious challenges in their life? What's out there? And when we went top to bottom in our thorough analysis for evaluating providers, EHN was the clear front runner. So we're thrilled to have you here today because ultimately now we can support people from that mild right through severe end of the spectrum and help people have healthier outcomes and be productive at work. So let's dive in.
And so many organizations are looking for solutions, right? And they're looking for options, more than maybe just, well, a lot of companies have an employee assistance program, which is great. and they've been pushed for a long time in the benefits community. But unfortunately, still we find the utilization is always really low with employee assistance programs, typically 8 to 11%. And and even more so now that the concern is that close to 40% of new long-term disability situations are mental health related, and it could be around anxiety and burnout, not necessarily depression, but it opens a whole other spectrum. So maybe, Dave and you and I have had some great
Yep.
conversations in the past around where EHN kind of fills that gap. So maybe speak a little bit about where you feel that EHN's been a great addition for organizations to consider as a solution.
Yeah. So historically, EHN having the inpatient treatment facilities, we really supported a lot of EAPs or employers when someone was no longer being serviced by their products. Often enough, if you're using an EAP, you're looking at short term, maybe 3 to 5 sessions of individual counseling. And that is great for the right type of client, but if you're looking at someone that has had ongoing substance use problem, for example, where they may have been struggling with alcoholism for some time and it's getting progressively worse, something that short term is not necessarily going to treat their concerns. And EHN has historically been the centers in which EAPs or other support systems would refer to. Now, what we're seeing is that, especially after COVID, a lot of the concerns that we see with people with moderate level symptoms, such as substance use, anxiety, depression, and other traumatic concerns, we're seeing that those are, I guess, coming to light more in terms of how they present in the workplace. And people are no longer relying on their EAP because after COVID, I guess there was a shift in how EAPs were perceived. It was previously perceived as the end all be all. Like if my employee has a concern, go to the EAP. During that time, it really exposed that the EAP was meant for a client in the mild category, and more people were presenting with moderate to severe concerns. So EHN, in providing that full spectrum of services, we're able to address a client at where they're at in terms of their needs. We're able to provide services that are more long term. We're also able to provide maintenance services for them. So I see EHN as an extension of what's already out there. As Rochelle mentioned, we have been around for 10 years or so, but what we're doing now is that we're presenting our services as that next step for individuals that are struggling while at work.
So this is probably a great continuation. You've covered a lot of great points there, Dave. We want to make sure we tackle all of those. And so,
Mhm.
Rochelle, maybe if a company is hearing this for the first time and they're knowing somebody that's maybe struggling and they've tried the employee assistance program or they've gone through their paramedicals real quick in their benefits program, is it usually an employer that reaches out then to offer, like they want their employee to seek your assistance? Is that typically, or what's usually the process?
So, right now, it really is often driven from the employer because most employees, their benefits don't cover this. They don't cover anything beyond EAP or individual counseling through paramedical. And so, what happens is that the employer has to recognize that something's going on. Maybe they have a short term disability plan, a long term disability plan, and the employee has already got to the point where they're probably not working anymore. Now, a lot of the work that we're trying to do with employers and with some of the new products that we have out are creating that access earlier so that employees can come directly to us. They don't have to tell their employer right away, and they can deal with it before it gets to the point where their employer has to intervene, and get involved or become a short or a long-term disability. And so that's what we're working towards, is getting that access.
One thing that's important to highlight too is when I put myself in the situation of an employee and there's something that is moderate to severe going on, oftentimes they're not necessarily sharing that with their family, but they're coming in, and because of the nature of the benefits plan, they're looking in their booklet, they're consulting with their HR, they're confiding in many cases with that people manager, that first line manager, to say, I'm struggling, what's available to me? And in the past, this wasn't available. So it's great to have that awareness, and then be able to provide an option and an encouragement for that employee to have a path.
What we're hearing, honestly, is that mental health is showing up in the workplace more and more and more. And you hear this across the board. that we have frontline leaders, right? Team leads, supervisors, managers, HR folks who are almost becoming the front lines for mental health conversations, because as people get worse with their mental health, their function starts to decrease. And when we talk about function, we're talking about people's ability to do all the things they need to do in their daily lives, right? Whether that's like home or family or work, but it really shows up at work. And so you get into these situations where managers are sort of having to go down the performance management road, and the employee is really struggling and unable to really cope at work anymore. And so these conversations are happening there. And of course, our frontline leaders, they're not counselors, right? It's not their fault. But they don't really know how to handle them. And then also oftentimes by this point, it's become more than an EAP is really suited for or meant to support.
Let's dive a little bit deeper there because I want everyone to be super clear on what you offer support for. And so you talked about alcoholism and drug addiction, other addiction.
Mm.
What else? What are some of those other moderate to severe, I guess, conditions that you would support as EHN?
So, depression, anxiety, those are really, really common, really prevalent within the Canadian population, and just some of the associated stuff that comes along with that, right? So anxiety can be sort of more social anxiety. It can be more of that intense worrying and hyper fixation on things. But we also deal a lot with trauma, and both workplace trauma and interpersonal trauma. So when we say workplace trauma, what we mean by that is an incident or a work environment that has contributed to a traumatic experience, or when things get really, really bad, an actual diagnosis of PTSD.
Yeah. So some cognitive aspects, but also physical. You talk about even, how does mental health and, when people are unwell, what does that look like? You turn to things that soften it, right? Whether it's alcohol or drugs or even eating disorders or things like
Mhm.
that. So all of this is something that, is can be very severe if left untreated. And that does obviously impact the
Yeah,
workplace.
absolutely. And so we touched on this earlier that employee assistance programs were meant for short term counseling. And there might be times where an employee assistance provider might turn back to the employee and say, listen, we're not going to resolve this in 5 or 6 sessions. This is something that's long term. So it's not necessarily every situation, but you're right. In these situations where someone needs more, maybe you could speak to the two great options your organization has, whether it's inpatient treatment, but also the virtual treatment, because I think they're two unique services that people would love to hear about.
So, for folks who need more than EAP or individual counseling can provide, and just for a quick example of kind of what that looks like, that really is where that function is starting to be impacted, right? So, a lot of individuals will have issues that can be resolved through individual counseling and EAP. You're probably not going to see them at work. You're probably not going to know because they're not feeling great. They're not feeling their best, right? They might have some depression, anxiety, things like that. But you're probably not going to see it really in the workplace because, they're kind of keeping it to themselves. They're keeping it together at work. And when they are less able to start to kind of show up the way that they usually do at work, is when we start to look at moderate, severe. And so for folks who are more in the moderate category, and again, moderate means that we are starting to have impact. We are starting to see that issue at work, but we probably don't have a lot of medical complications yet, right? We probably don't have a lot of, physical dependence or multiple concurrent disorders that are not now all kind of interacting together, which is pretty common as things get worse. So for those kind of moderate folks, we have our virtual intensive outpatient program. And what that is a program where people can get a lot of support, but they can do it while they're still working and while they're at home. And so when we say intensive, we mean intensive. It is 9 hours of therapy a week, which is a lot, right? I always encourage people when they hear that to think about how bad things would have to feel for you to find 9 hours a week in your life to do therapy and to do that for 8 weeks, right?
So 72 hours over an 8 week span,
That's right.
which I think is great
Yeah.
because either knowing people that have gone through therapy, if they're going once a month, or are they putting together those skill sets to and adapt on their own when they're already struggling, right? They're struggling to kind of they're stuck in that middle of that kind of tornado, as I always like to describe it. So That's intensive. I didn't realize it was 72 hours. That's amazing.
I
It's a
can
lot.
imagine it's almost like, I'm relating to, joining a gym, right? So
Yeah.
you join a gym and to see results and feel better faster. Of course, you're going to be sore for the first few days, but you start that treatment and you're going to quickly feel good and feel like you're developing that habit right away versus waiting to go once a month.
Mhm.
I don't know if that's the right analogy, but that's what it feels like to me is you're getting early, ongoing, regular treatment daily or a
And,
couple
and
times.
and the other big thing too is a lot of people are struggling just to get
Yeah.
appointments. They're waiting to get appointments,
Absolutely.
or they're waiting, right? And so
Yes.
for you to quickly start 9 hours, so it sounds expensive. So we can talk about that in a little while as well. It's like, how do we pay for that? So sorry, yeah. So we should keep going.
Yeah,
It's
no,
great.
no, it's great. And so what that program is it's a very, very skills-based program, right? So again, we're tailoring that treatment to that person who's in that moderate category. And what we're thinking about is how do we use evidence-based treatment approaches, right? Treatment approaches that we know work, they're proven to work for most people, and we teach them the skills that they're going to be needing to manage the symptoms, right? So when I have that really anxious spiral that is triggered by a specific conversation or event at work, how do I get myself out of it? And what is a specific skill that I can use to move away from that anxious feeling? Or if I have a substance use problem, what am I going to do in that moment when I want to escape my feelings and I want to use a substance to cope? What am I going to do instead? How am I going to investigate and deal with those feelings? So it's a very, very skills based program where we're really teaching clients how to manage what will inevitably come up for them. We also support their families with our family education. So it's really important that we have our families and our clients kind of speaking the same language, working towards the same goal, right? And when we say families, we really just mean their support system, roommate, partner, parent, whoever is really going to be helping them. And then we offer long term aftercare, which is really important. So when we think about treatment, right, when we think about any intensive portion of treatment, whether that's a virtual intensive outpatient program or an inpatient program, we need to think about long term maintenance, right? If you go back to your gym analogy, right, it takes a long time to build a habit. It takes a long time to change your lifestyle, change the way you live. And what we're actually trying to do with therapy is helping people change the way that they think and helping people change the way that they react to situations. And that takes a long time. That's a time investment. And so what we then do is after we finish that 8 weeks of intensive support, we offer that 10 months of long-term aftercare where they're now seeing us once a week so that we're helping them continue to integrate all of that learning into their day-to-day lives.
That's so important. Just like a trainer, right? Now you're back to this
Yeah.
analogy again, but like you learn the program, you get the instruction on a frequent basis, then you have that confidence and you've had a few practices, a few wins under your belt, but you still have that accountability and long-term check-in, right? Because that habit does take a while to ingrain. So very good to understand that. And after you've built that habit and you're in that long-term situation, I'm a data-driven person. I want to understand what type of success rate, if you have that evidence, what is that percentage of long-term success rate for clients that go through that outpatient experience?
Yeah, for sure. So right now what we're doing is we're measuring outcomes for clients from week 1 to week 8 and we're looking at how much did their symptoms decrease from week 1 to week 8 and we have some really great outcomes on that. I think it's about a 60% drop in substance use symptoms and cravings from week 1 to week 8. I don't have all the numbers right off the top of my head, but we see those symptoms decrease from week 1 to week 8. We're launching a new outcomes program right now, measurement program this fall, to be able to look beyond that, to be able to see where they at 3 months, 6 months, 12 months post program. And the important thing I think to know about mental health recovery is that it's not linear, right? You're not just going to take this program and that's it. You have all the skills and you're always going to use them perfectly. It's just, that's not how humans work, right? And so it is going to go up and down. There are going to be issues, but what we're really working for is to have our clients know how to get back to where they want to be, right? So it's not that the client is never going to have anxiety again or, you know, never have a depressive episode again, but we want them to know how to use their skills to cope with that episode and get out of it quicker, sooner, and get extra help when they need it.
And it's really tailored to the individual too that's coming in, which is
Mhm.
great because we've always said that mental health isn't a product. It isn't
Mhm.
like do this and then this happens, right? Every situation is different. David, why don't we flip it to something that where there's situations where someone needs to be inpatient, right? That they need that
Mhm.
kind of 24/7, care and guidance. So maybe can you speak to us a little bit about EHN's inpatient program?
Our inpatient centers are meant for clients that are experiencing severe symptoms. Those are clients that they're no longer at the point in which they're able to show up in the ways that they would like to show up at work. Some of their symptoms are very apparent to their family members, very apparent to their community, their loved ones, and they're at the point in which they may need a little bit more support on a 24-hour basis, whether that be clinical support from a therapist or a support counselor who is essentially a therapist in training, or medical support. So they may be someone that has been experiencing depressive symptoms and anxiety based symptoms to the point where they're using pharmaceutical drugs to cope with it, and they might need the support of a psychiatrist. So when someone is going into our inpatient center, they have the support of our clinical team, which has master's level therapists. Our clinical team also has support counselors, who I mentioned, who are mental health professionals. They do informal counseling with individuals throughout the day, and they also support them throughout the night in case there's any occurrences. They have medical support, so nurses and doctors are on staff. They also have support of different health professionals as well, such as dietitian, people that are experiencing mental health and addiction concerns aren't necessarily looking at their diet and looking at their nutrition. And there's a lot of research that shows that diet and nutrition is linked to mental health, and those are some of the things that start to slip when individuals are unable to care for themselves in that way. We also have personal trainers and other wellness staff, such as recreational therapists, that are supporting clients.
Okay.
So when someone is in an inpatient center, we do have medical detox, which is available. And that is just the medical side of detox. Detoxing off of some substances, such as alcohol, can be dangerous. It can lead to seizures, or it can lead to hallucinations. So we want to make sure that we have a care team to support them while they're detoxing off the substance of choice, or if they're even doing a medication change off of different prescription drugs. And then after they go through that detox portion, we're going to be engaging them in intensive treatment, similar to our virtual program. Difference there being that it's in person, and they're also going to have the support of our team to encourage them to go to different group sessions and encourage them to go to their individual counseling sessions. We want to make sure that we're motivating clients to engage in the programs, because as we know, when someone is experiencing mental health and addiction concerns, it can be very challenging for them to attend different sessions. It can be very challenging for them to get out of bed. So we want to make sure that we have the staff around to encourage them to do this. And then as they progressively get better throughout the program, then we start to teach them different skills and different concepts related to mental health. We primarily focus on cognitive behavioral therapy and dialectical behavioral therapy. Essentially, they're treatment modalities that help people challenge maladaptive thoughts and maladaptive behaviors. And it's a concept that essentially says that our thoughts, our feelings, and our behaviors are all linked. And if we're able to change our thoughts, then we can change how we feel about certain things, and we can change how we behave or react to them. So we focus on that. We also introduce peer support. They have a community around them to encourage them to challenge certain thoughts that are not beneficial to them. And then we move into relapse prevention. And relapse prevention, a lot of people think about it as only being something that relates to substance use. We also teach relapse prevention when it comes to mental health, because there are symptoms and there are certain behaviors that people that are struggling with mental health concerns tend to slip back into. So whether that be missing certain appointments, or knowing that they should be avoiding a certain area because it causes them anxiety, but then going back to that area, or sometimes it's having a certain reaction to triggers. So we teach that relapse prevention to help people understand that while you're at the center, you're in a very safe space. It's a place where everyone's here to support you, but it's not always going to be like that when you go back into the world. So how are you going to challenge those triggers that cause you to react in a certain way? And how are you going to change that reaction to be something that's not maladaptive and isn't going to be detrimental to your happiness or to your health?
Wow, I learned so much in everything you just said. I feel like that patient immersive experience is something that you have to go deep at that point and have
Hmm.
that circle of support. So when we think about, the difference of what that experience, both inpatient and outpatient, that you both just described those services, and we bring it into the benefit package world. So, Rob, you as an advisor, I can imagine employers would be looking for, okay, I'm going to put someone and help someone go through these treatments at a certain cost. What type of information or how do I best support this? Because this looks a lot different than the short term EAP.
So many companies are trying to be more proactive with their mental health benefits that they provide more than ever before. So we're seeing
Hmm.
companies, double their mental health practitioners. We're seeing them add, psychotherapy or maybe family counseling, maybe, certain mental health practitioners that might be a little bit more cost effective per hour, say, than say seeing a psychologist. It might be readily available. But where organizations, at the end of the day, sometimes it's still not enough. What I really like about today's conversation and Benefits Alliance work with EHN, it's the first real mental health solution that's clinically focused, especially whether it's around virtual or inpatient services. Rochelle, can you talk to us about your idea of going to like through the advisor network to work with organizations and companies around options and solutions for them to make it maybe a little bit more cost effective, knowing like the intensity around the counseling, and especially the significant on-hand approach in your clinics. How are you helping organizations navigate that potential barrier?
Sure. Yeah. It's an important question. And I think it all starts back from our mission that I kind of touched on before, right? Accessible, affordable, excellent. We allow our mission to guide us in every decision that we make. And most Canadians don't have access, right? Public wait lists are very, very long. We don't have enough public spaces. And if you want to go private, it's very expensive. It's unaffordable for most people. This is the truth. And so, if we can go through the benefit side, if we can work with employers, if we can work with brokers, when employers are crying out, like this is a need that they have, and our mission is to get treatment to people who need it. And so if we can work together, we can achieve that together. And if we use a per employee per month model, it makes it so much more affordable than paying, especially with small employers, than paying per employee, right? And here's the thing, right? Is that the majority of people do not need the more intensive services, right? Most people are going to be fine in the mild category. They're going to get what they need, especially if we make paramedical benefits a little bit bigger, because 1,000 doesn't really get people where they need to be with individual counseling. But a lot of people are going to be okay in that area. It is a smaller group of folks who need intensive support and who need an intensive outpatient program or an inpatient program. But those are the folks that are going to end up on disability most likely. So
And what percentage of people would out of say 100 people would need kind of inpatient?
that is a really tough thing to say because, the longer we leave things, the worse it gets.
Yeah, sure.
So, we know prevalence. We have all these prevalence rates of anxiety, depression, substance use disorder from Statistics Canada, which is great. But that is just giving at any time, right? It's sort of like I think it's 1 in 5 people will have experienced a depressive episode in the last year.
Plus, we have more people coming forward asking for help
We do.
and not fighting it,
That's
right?
right.
So I think that the prevalence is probably increasing. It's still low as a percent. Like most people, like you said, get the help they need in the mild zone,
Mm.
but there's more people that are willing to say out loud
Mm.
in the severe category, I need help and I need
Mhm.
a solution.
the younger generation into the workforce now is absolutely more in tune from an emotional standpoint than maybe the generations prior to that didn't openly speak about their emotions when it came to that I was struggling with mental health. They were when it wasn't kosher 30 years ago to say like I'm not feeling
Or
right,
essentially, I'll use the word confessing that, like, I am
struggling.
taking some extreme measures that are not healthy,
Yeah.
and I
Yeah.
need help, and where do I go next? So on that note, let's hear about what you've built, right? Because it's you want to make affordability and accessibility. Let's dive into that.
So that was actually something that came to us as a request from a broker. Our previous model was trying to partner with different companies, trying to do a lot of education around how mental health affects different industries. And there are differences just depending on jobs, such as how long employees are working for, how much stress the job brings to them. Even working night shift versus day shift has effects on mental health. But in talking with that broker to really understand benefits and how benefits work, we were able to really marry both our mission of making mental health more affordable as well as our mission to make it more accessible. So creating that subscription based model, it allows us to catch people earlier in their journey to recovery. What we found before was that if they're in that mild category, they would kind of get worse. And then there would be that gap in the moderate category. And then they'll just wait until they're severe enough to consider inpatient treatment center. If we created that subscription based model where we covered all the mild, moderate, and severe categories, we can offer a less expensive service earlier in their journey so that we're not actually getting people to that severe category where they're on disability, where they're missing work, where they're taking a lot of pharmaceutical drugs in order to manage their anxiety and depression, which can also be another expense. We're able to actually provide them services that are more appropriate for where they're at when we get in touch with them. And then it's also a service that's cheaper. So it kind of allows us to do two things there. It allows us to, one, catch them earlier in their journey, and then two, make it more affordable for everyone that has access to the service.
As an advisor, companies can relate to that per member per month kind of payment, right? They're used to that and it makes it budgetable, right? Which is, I think, another thing in today's economy that employers are concerned about. And I also think now what's even more critical is to communicate it. So maybe,
Mhm.
communicate to members. So maybe either of you could speak to how you communicate this to members if you're working with an organization to let them know they have the services available because there might be situations as we talked about they don't want to bring this up to their employer. They might come directly to you.
Yeah. And as we've been saying, we are a healthcare company first, and we're very used to working with referents in terms of communicating different concerns or communicating how to talk to your employee population. So we actually have a launch package. We have a launch package that we provide to companies that are working with us. 5 things that you can do to make a mental health connect successful within your organization. It comes with different marketing material. We work very closely with different companies in order to frame that marketing material so that it speaks to their employee base. Even simple things like changing the imagery to reflect the occupations that are reflected in. We do things like that. We check in with companies quite often. So we have health, we call them health checks. We call them health checks to check in with them. We're providing reporting on a monthly basis so that they can see, oh, how their employee base is faring. So if they have a hunch that, anxiety might be a concern, that report might actually reflect that depressive symptoms or substance use symptoms is a concern. So then we can work closer with them to provide more education to their employee base on how they can properly address their mental health concerns. We make them aware of the screener. And the screener is something it's not a passive tool. It's not like hey, I'm struggling, let me do this screener, and then now I know that I have some issues. It's very active in the sense that they do the screener, they have access to our team to help them navigate the different treatment options that they can do. Our team is reaching out to them to say, hey,
direct and confidential. So
Yeah.
the member could complete the screener, it gets sent in. The
Mhm.
results are not going to their employer that
No.
Rob completed this screener. Okay, great.
No, it's aggregate data. It's
Right.
aggregate data. We only release information to the employer if the employee themselves disclose that they would like the employer to be aware of their treatment. So we're working very closely with referrents, and we're also working very closely with employees. And one thing that we found is that the employees are really, really involved with our alumni services. And they often become champions of EHN, and they return to their workplace. They make people more aware that these benefits are available. And that seems to be a bigger motivator for other employees to come forward with their mental health concerns and try out our product because they're getting a familiar face telling them that it's worked for them.
It's great to hear.
One quick logistical question or practical question I would ask is it's great that you've built the per employee per month model. If there's an employer out there listening right now and says, I know someone that's in that severe situation, but I'm not signed up right now, what can I do? Can I purchase and for my employee to have them go in the inpatient program or the outpatient program? Can they do that right away?
Of course,
Yeah.
always. Yeah.
Okay, so that looks like basically you'll have a price point for all the categories. I want to end with actually a little bit of feedback for you. And I always like to bring forth, Rob speaks for the advisor journey and building that out with employers. You've built an employer solution. I'm going to take the opportunity to talk about what I've heard for personal feedback in a member that has come to us and shared their personal journey in being in a severe situation of addiction and making that very difficult choice to essentially make that phone call and say, I'm at my rock bottom. I need help. And I'll just simply say, and you can add to this, but this was their experience. They called in and basically had the courage to do so. And what I heard from them is you ultimately helped them walk through the decision of what it looks like to check in. You help them with the conversations they would have with their mother, their employer, their children, their spouse to help them prepare to check in for ultimately 50 days. And all of the tools when you're at your rock bottom, it's very difficult to imagine what that looks like. And all I
Mm.
can say to you is that helped them get through the door. So that experience, the rest is up to them and to your services. But would you have anything to add to that plan member experience or that person that's reaching out that you want to make sure that listeners understand?
I would say that a lot of our staff have personal ties to mental health and addictions work. A lot of our staff have had their own journeys with recovery, and it's not like we're approaching mental health and addictions from a textbook, evidence based approach at all times. Sometimes we need to humanize the struggle. And often enough, it can be such a small thing that allows someone to make such a big difference in their life. I myself was actually here at Pearson picking up a client 2 weeks ago because the difference between them getting help and not getting help was having someone escort them from the airport to the center. And small gestures can make a big difference to people. And our staff understand that from their own experiences and from the experiences of their peers or the experiences that they have within their families. So we're really careful when selecting people to be a part of our team. And part of the reason why all EHN facilities are owned by EHN, operated by EHN, they're not contracted out, is because we want to really control one, quality, but two, also have members of our team that really care about people first.
Amazing. Well, thank you for sharing that experience. I can tell we'll probably have you back as well. We've had so many guests that, this is a critical time. And it's just amazing to know that for an employer and for employees out there in Canada, you can get the help you need in a timely fashion in the way that you need it personally from mild, moderate, severe. So thank you for joining us
Yeah,
today.
absolutely. Really glad everybody got to hear your story today, and good for you to extend that arm for the individual at Pearson. That makes a difference in not only that person's lives, but their family lives. So, Rochelle, David, thank you so much for being here today.
This is the Benefits Alliance voice. If you enjoyed this episode, please share it with your network and subscribe wherever you listen to your podcasts.